eye lifts are called blepharoplasties, and we bring in brow lift with blepharoplasty because the brows do affect the eyes. Because brow lifts are going to elevate the brow, and it turns out that brows have a feminine and masculine appearance. If the brow is elevated, it's more feminine. If it's lower, it's more masculine. The brows bring in skin into the upper eyelids if they're low, and you can have all the forehead wrinkles we're all familiar with. And if your brows are low, you tend to raise your eyebrows, and that constant raising gives you wrinkles in the skin. So anybody, we're looking at their eyes, we're also evaluating their brows. And so here's an example of how brows can convey emotion as well, not only masculine and femininity. So these pictures, smiley faces, are all the same. That one looks a little sad, that one looks a little devious, that one might look a little tired, that one looks awake and alert, right? So look at this next before and after picture. Does she not look sad and tired and unhappy? And she's a school teacher, of course, and loves her job, loves her kids, likes to go to school every day, but she's really tired of people asking her, "Well, don't you feel good? Or you don't want to be a teacher anymore?" So her brows are low. They're at her bony rim. They're down slanting when they ought to be up, above, and arched. And you can see by lifting those brows up, we get rid of all that upper eyelid skin. She also had some skin removed from her upper eyelids, and you can see a little incision up there that could be better. But again, one of those things that's much better but not perfect. And then the shape of her face with a neck lift and facelift. Here's a lady who had brows done. You can see the asymmetric upper eyelids. See the brow positions better. Look how much prettier her eyes are. So everybody who comes in for an eyelid appearance, we also look at the brows. If the brows in the right position and there's skin in the upper eyelids, it's all upper eyelid skin. If the brows are in the wrong position, we put them in the correct position and then look at the eyelids. And if there's no skin, it's all brow skin. And so you have to make a diagnosis. What's the problem? Is it brow problem? Is it eyelid problem? Or is it both? And as soon as you make a diagnosis, you know what to do. Same thing. You know, down here you can see the puffiness here that she doesn't have, and her incision is just under her lash line. Did not do her upper eyelids. Upper eyelids, lower eyelids, there she is afterwards. Hard to see her incisions.
That's upper and lower?
That's upper and lower.
Beautiful.
Look at that, Cal. You didn't even know she had pretty eyes because all that puffiness. So an incision up in there, an incision right in there, and there she is.
Did you have to remove fat under her eyes?
You know, we do. That fat is normal orbital fat that's in the orbit protecting the globe so it doesn't bang around in there. And it's not that she has fat eyes, it's the structure that's holding her eyes back. When she was 18 was like that, and now it's like that. And so when light comes in our world from above, hits that puffiness, casts a shadow down below, because the orbit is round, the fat is held back by that round structure, and it looks like a circle. So we go take that fat out, we tighten the muscle, and we tighten the skin. So it's skin, muscle, fat again. Same thing. Lower lids, upper lids, pretty easy. Here's an example of a lady, really good, because we're talking about who needs this and who doesn't need it. She said she needed a brow lift. I didn't think she needed a brow lift. She got a brow lift because it's safe and I'm not the brow police. Her incisions are up here, right at the hairline, because she had a high forehead and didn't want to make it any higher. So we put the incision right at her hairline, but I think you can tell it's pretty good. And you can see what a brow lift does for upper eyelids. See, that is a better upper eyelid than that, but in my opinion, that brow's too high. And that is something most people come in and say, I don't want to look startled with a brow lift. We can do brow lifts endoscopically, or we can do them open. Hers is open, where she has incision all the way across. We can make an incision there, and with fiber optics, do it endoscopically, which is what most of the time we do.